Hi, I'm Eric Simpson. I am a urologist at KSB. I've been practicing here for just over 2 years and I've become an active member in the community. I really look forward to seeing our local patients and referrals from our primary care physicians, as well as I see plenty of patients who come to the ER with emergent issues. I am located in Commerce Towers, just adjacent to the hospital, and if you find that you have any urinary urologic needs, feel free to call the office or contact your primary care physician so you can have a referral set up immediately. And PSA screening. For approximately 80% of men starting at age 30, the prostate starts to grow. It also starts to change. As it does so, the prostate can have muscle development that causes it to be more firm and less flexible. In addition, the prostate can grow and squeeze off the tube that we use to urinate. Because of this, men will develop certain symptoms related to an enlarged prostate. But not all men with an enlarged prostate will necessarily have symptoms. While some men do not have symptoms related to enlarged prostate, this can be related to the general size and shape and location of the prostate and how it grows. It can also be related to the bladder being able to compensate for blockage related to the prostate. While the bladder can accommodate for some blockage for a period of time, eventually the bladder can become weak by overworking in relation to the blockage. This can cause other symptoms not related to blockage but related to bladder irritability. Symptoms related to an enlarged prostate with a blockage are initially usually decreased force of stream or weak stream, trouble getting your urinary stream started, sometimes where the stream may shut off in the middle of while you're going to the bathroom, sometimes having dribbling at the end of your stream. Symptoms that would be related to irritability, secondary to an overworked bladder, may include urinary frequency, where you have to go to the bathroom more often than every 2 hours, and where you have to go urgently, where you cannot wait when you go to the bathroom. So continued issues with the bladder can subsequently result in urinary retention, and this is where the bladder does not empty all of the way. Some people will not empty their bladder all the way and still not notice they have symptoms, but it can decrease your overall bladder capacity so that you cannot hold as much urine. Because of this, people will sometimes also develop having to go to the bathroom more frequently and more urgently. If urinary retention or not being able to completely empty your bladder worsens, there is potential for backup to the kidneys, and that can cause renal damage and potentially renal failure. One of the more common symptoms that we hear about related to an enlarged prostate can be nocturia, or getting up frequently at night to go to the bathroom. As we age, this can be related to sleep disturbances, where we wake up easily for small sounds, noises, or just have poorer sleep patterns than when we were younger, though it can also be related to a bladder that is irritable secondary to a large prostate. Again, if a bladder does not empty all the way when we lie down at night, we may have to get up more frequently to go to the bathroom because our bladder does not empty all the way like it should. Again, I do want to emphasize that the size of the prostate does not always correlate to symptoms, and some people with a very large prostate might not have any urinary symptoms at all. Symptoms can be worsened by certain medications, such as those for allergies, including ephedra or pseudoephedrine. These cause the prostate to not be able to relax so much. Other things that irritate the bladder and cause worsening symptoms are bladder irritants, and these include things such as caffeine, alcohol, spicy foods, and acidic food. When we talked about nocturia earlier, or getting up at night, this can be caused by several things, not specifically related to urinary retention or the bladder. These would be things such as lower extremity edema, when your legs swell and you lie flat at night. The fluid from the legs can get processed by the kidneys and subsequently make urine. We can eliminate this as a problem by elevating our legs 1 to 2 hours before bed so that most of the fluid is out of our legs before we go to sleep. In addition, anything we drink 2 hours before bed will get processed by the kidneys at night and cause us to make urine and potentially wake up. Of bigger concern is alcohol, which can have effects up to 3 hours before bed and also is irritating to the bladder. In order to eliminate this as a problem, compression stockings can be used during the day to help squeeze fluid out of the legs so there is less swelling. And again, limiting any caffeine or alcohol 2 to 3 hours before bed, as well as any other fluids. Although symptoms related to the prostate can be irritating or bothersome, problems related to outlet obstruction or a bladder that has blockage and cannot function as efficiently can create other problems than just symptoms. And these would include things such as urinary tract infections, renal damage, developing bladder stones or stones within the bladder that can cause bleeding and recurrent infection, blood in the urine related to enlarged prostates or stones within the bladder, as well as bladder infections. And again, if there is enough fluid in the bladder that it can back up, it can go to the kidneys and cause hydronephrosis, which is swelling of the kidneys, and subsequently renal or kidney failure. In order to treat symptoms related to the prostate, we typically undergo an evaluation where we try to characterize the symptoms as best as we can, usually utilizing a symptom score sheet. We can evaluate to make sure that the bladder does empty all the way. We also talk about family history, and we'll occasionally use the PSA to get us a better idea of the size of the prostate. This is a lab test. Once we have the symptoms characterized, there are different ways that we can treat. One of the ways that we treat is with what we call an alpha blocker, and there are specific medications for the prostate. If you recall, we talked earlier about how the prostate can become firm because of increased muscle tone within the prostate as people age or as the prostate enlarges. We have medications that are specific muscle relaxants for the prostate to soften the prostate and allow the bladder to empty easier. By decreasing the outlet resistance, the bladder has to work less hard and is more efficient, and typically symptoms improve. We can also try to shrink the prostate at times by using what we call a 5-alpha reductase inhibitor. Essentially, what this medication does is starve the prostate of what it needs to maintain itself and to grow. The result is that it can shrink by approximately 25% over a year's time. Most patients will see some improvement within 3 months, but the majority of the improvement is within 6 to 9 months. I do want to mention supplement therapy, which I do not necessarily advocate, but it is present and it is seen a lot on the internet. Most patients choose to use something called saw palmetto. While we do not know how this works, it does seem to work in some patients, but its efficacy is not great enough that we would recommend it for all patients. Because of this, I do not recommend the medication or supplement, but if you have success with this medication, I do not necessarily recommend stopping. We will talk about surgical intervention in a minute, but I do want to talk about irritable bladder. Before we mention that a bladder that becomes tired from overworking because of a blockage can become irritable, and subsequently you may feel that you need to void more frequently and more urgently. If we can document that there are no problems with emptying the bladder, there are other medications that we can use to quiet down the bladder so that you do not have to feel the urge and have to go to the bathroom so frequently. This will sometimes improve the length of time between going to the bathroom, as well as the overall volume. These medications are usually best used in conjunction with the other medications I previously talked about regarding treating the prostate to limit the obstruction. In regards to surgical intervention, there are multiple different surgical options that can be tried related to blockage by the prostate. Once we have used all medical intervention prior to surgery, surgery would be the only option. However, we can always proceed to surgical intervention sooner if there are too many side effects with medication or if a patient does not wish to go on medication. Also, there are some procedures which help preserve more sexual function in a younger patient that may be more beneficial than going through medications as as an older patient may be more interested in. The typical gold standard for surgical intervention would be called the TURP, or transurethral resection of prostate. In this, we essentially go in and core out the prostate like you would core out the inside of an apple. What this does is open up the blockage that is completely obstructing the flow of urine from the bladder. And by removing this blockage, we can sometimes come off some of our medication, if not all of our medication. Patients will no longer have urinary retention, and their voiding profile or their overall symptoms will improve by sometimes up to 80%. Other methods to do similar removal of the prostate can be laser therapy, where the prostate is vaporized, and Resume, which is a new treatment that has been out for a little while, where the prostate is steamed, which causes the prostate to subsequently die and the body to absorb it in areas. And this opens up the prostate again so there's flow. I mentioned before that there are procedures that will help maintain sexual function, and the steaming of the prostate is one of those procedures. Because the overall shape of the prostate doesn't specifically change, but the size and obstruction does, people can still maintain their ejaculatory function or ability to conceive. These are just a few of the potential surgical interventions that you can be offered to help treat the prostate related to urinary symptoms. In addition to evaluating the prostate because of urinary symptoms and blockage, we use a test to help determine overall size of the prostate as well as potential for prostate cancer. This is the PSA blood test. What this test allows us to do is help determine that no cancer exists in the prostate prior to any treatment. Normal numbers indicate that we can treat the prostate as it is normal prostate growth. We do not want to treat the prostate as it is simply enlarged if there is a cancer component, as this will not likely resolve symptoms, and symptoms may actually worsen over time. In addition, we would miss diagnosing a cancer that later down the road could create significant problems or even death. In regards to the PSA and potential for prostate cancer, this is just one of the tools that we use to help determine whether or not a patient may need a biopsy to determine if there is prostate cancer. We utilize the prostate exam, family history, symptoms, as well as the PSA in order to determine whether or not a biopsy is warranted. Recently, there has been some confusion regarding PSA and its overall utility in order to screen for potential prostate cancer. I'd like to make the differentiation that screening is in somebody who has no symptoms and we are looking for cancer as a preventive tool. Whereas somebody who may have symptoms, using a PSA is not a screening tool but a diagnostic tool in order to ensure that there is no cancer before treatment. Typically, nobody under the age of 40 should be screened for prostate cancer. There is a very low likelihood of having a problem with the prostate or potential cancer, and screening in these individuals will likely result in tests that may impact the quality of life but not necessarily improve the quality of life. PSA screening is not for people who are of average risk who are age 40 to 55. These patients, similarly to those who are under 40, are not likely to have a cancer. They are more likely to have impact in their quality of life than improving the quantity of life by diagnosing a malignancy, period. That being said, patients who have a higher risk profile may benefit from screening earlier to establish a baseline. These patients include family members who have been diagnosed with prostate cancer, multiple family members with prostate cancer, family members with other adenocarcinoma diagnoses such as breast cancer and pancreatic cancer. Starting at age 55, patients should be screened for prostate cancer. Sometimes the screening can be of different duration, meaning not everybody needs a PSA test every year, especially if their numbers are what we would determine to be appropriate. Also, prostate cancer screening is not typically for those over the age of 70 or those who have a life expectancy of less than 10 to 15 years. In regards to the PSA, this is not a diagnostic test for cancer, but only an indicator for cancer. That is why sometimes after being screened for prostate cancer, your primary care physician may refer you to a urologist like myself for further evaluation. We typically look at the velocity of the PSA or how much it changes over time. We can look at the density of the PSA and how it relates to the size of your prostate. And we can look at other PSA tests to determine your overall risk of prostate cancer. Some patients who meet the criteria for an elevated PSA may have a normal risk and not require biopsy, whereas some patients may have evidence of a more aggressive disease and require biopsy sooner. If the evaluation for your urinary symptoms indicates that you have an obstruction not related to cancer or other issues, you likely would benefit from treatment with medication and or a potential surgery so that you can go back to limit getting up at night, allow for longer periods of time between going to the bathroom, and helping to eliminate the need to rush to the bathroom urgently with potential leakage. I hope that you have found this informative, and I do look forward to your questions. Take care.
Thank you, Dr. Simpson. That was a great program. If you have any questions, comments, please comment below. Otherwise, thank you for joining us, and we look forward to seeing you at future presentations.